Hi all, I am Dr. Malathi, working as a professor in Tripoli College of Nursing. So in this video, I am going to discuss about the mechanism of labor RSA, which is nothing but right sacro anterior. So this is a mechanism which comes under the breech presentation. So this is going to be a demonstration procedure for MSc nursing students, BSc nursing students, and for the post-basic students. The objectives are introduction, definition, principles, characteristics, movements, summary and conclusion. Introduction. Right sacroanterior, it is a fetal position in which the sacrum of the fetus is directed towards the right anterior side of the maternal pelvis. It is commonly seen in the breech presentation and is considered as a favorable position for delivery. In RSA, the fetus aligns well with the maternal pelvis, allowing the smoother progress of the labor. Understanding this RSA is important for nursing students to assess the fetal position and provide the appropriate care during the labor process. Mechanism of labor definition. As the fetus descends, the soft tissue and bony structure exerts pressure which leads to descent through the birth canal by the series of movements. There are three principles totally. First principle is descent takes place throughout the labor. Second principle is whichever part leads and first meets the resistance of the pelvic floor will rotate forward until it comes under the symphysis pubis. Third principle, whatever emerges from the pelvis will pivot around the pubic bone. Characteristics. The lie is longitudinal here. Attitude is one of complete flexion. The presentation is breech. Position is right sacroanterior. Denominator is the sacrum. Presenting part is the anterior right buttock. Here, the bitrochanteric diameter, that is 10 cm, enters the pelvis in the right oblique diameter of the rib. Sacrum points to the right iliopectineal entrance. Next, coming on to the movements. First is compaction. Descent takes place with increasing compaction owing to increased flexion of the legs. Second movement is internal rotation of the buttocks. So here the anterior buttocks reaches the pelvic floor and rotate 1/8 of the circle forward along the left side of the pelvis to lie under the symphysis pubis. The bitrochanteric diameter is now in the anteroposterior diameter of the pelvic outlet. Lateral flexion of the body. Anterior buttocks escape under the symphysis pubis. Posterior buttocks sweeps the perineum and the buttocks are bound by the movement of lateral flexion. Next movement is restitution. The anterior buttocks turn slightly to the woman's left side. Next movement, internal rotation of the shoulder. The shoulder enters the pelvis in the right oblique diameter as the buttock. The anterior shoulder rotates forward 1/8 of the circle along the left side of the pelvis. Thereby, it escapes under the symphysis pubis and now the posterior shoulder sweeps the perineum and the shoulders are bound. Internal rotation of the head. Here, the head enters the pelvis with the sagittal suture in the transverse diameter of the brim. So, the occiput rotates forward along the right side and the suboccipital region impinges on the undersurface of the symphysis pubis. Next movement is external rotation of the body. So, at the same time, the body turns so that the back will become the uppermost. Finally, the birth of the head. The chin, face and sinciput sweep the perineum and the head is borne by the movement of flexed attitude. Summary. Right sacroanterior is a favorable fetal position seen in breech presentation, where the sacrum of the fetus is directed towards the right anterior side of the maternal pelvis. This position allows better alignment of the fetus with the maternal birth canal, facilitating smoother progress of labor. Proper understanding of right sacroanterior helps in accurate assessment and monitoring during the delivery process. Conclusion. Right sacroanterior is considered a normal and advantageous position in breech presentation that supports the effective labor. Knowledge of this position enables nurses to identify the normal progress and detect the deviations as early as possible. So, timely observation and appropriate care by nurses can help to ensure a safe outcome for both the mother and the baby. References. Thank you.